Thank you, Karen Corlin, and thank you, Ministers. It's great to see the two Ministers here today. And I'm also part of the committee, and I know how hard everyone works. So, like that, Ministers, it is time for action, and this is a call for action. Action is highlighted in the committee's Budget 2022 pre-budget submission to ensure that the programme for government commitments that oblige action for inclusion, so that the concerns and needs of people with disability are meaningful, addressed, and for disability funding to be aligned with the United Nations Convention on the Rights of Persons with Disability. And, you know, Minister, as we all know, this is about people with disability, but they have to be living their best lives. This is about inclusion for people with disabilities, which can only be truly achieved through adequate funding being allocated in the national budget for the various sectors relevant to the realisation of the people with disabilities under the UN CRPD. This is crucial because for centuries people with disabilities, in particular people with intellectual disabilities and also with mental health problems, had been institutionalised and segregated from mainstream society. Currently in Ireland, the rate of poverty and social exclusion for people with disabilities is one of the highest in the EU at over 38%. We also have the lowest unemployment rate of people with disabilities across Europe. And I know, Ministers, that is a concern for you, and it's really worrying. We must meaningfully address the realisation of the rights of people with disabilities under the UN CRPD as committed to in the programme for government. When I take clinics in my office in County Carlow, I am reminded of the barriers placed for people living with disabilities. Those with disabilities who are incontinent, facing staggering charges for their bins. I just had a lady ring me recently, and it's a huge issue because they are in poverty, and that is something that we really need to address. This morning we heard in committee from witnesses discussing the limitation of disability services in providing for chronic illnesses, and one highlighted was the lack of public toilets. These are barriers to people, and they seem like simple things to fix, so we really do need to fix it. The motion calls for a step change across all sectors of society, from a medical model of disability to a social right-based model of care, which ensures the inclusion of all groups of people with disabilities across our communities. My biggest concern, and one shared by all of the members of the committee, is the rate of poverty and social exclusion for people with disabilities in Ireland, which is one again of the highest in the EU. The level of unmet need in the disability sector must be addressed and the Disability Capacity Review published. Let me talk about some other issues, and I myself, both in the committee and in Carlow and Kilkenny, these are concerns that I have. And Minister Butler, I do want to thank you. We are getting our Holy Angels building. I've been at meetings recently about the design and that, but there is just issues that we're going, even though we've got the site and it's on the capital plan, we're actually going on plans from 2017. And my concern is, and I've said this to you, is that I just feel that it's nearly 6 years on, and I am concerned that we're not taking into account the expansion of services which is occurring in Carlow, and I'm sure that's happening in all other counties, in Kilkenny as well, because I do know from speaking with the different services, there is definitely resources needed, and children are still facing huge barriers in accessing treatments and support. And I would ask you, Minister, that you would look at that. Now, I know the funding that you're putting in, and I do understand that, but I just feel there is still a lot of concerns out there from parents that I am working with. And also another barrier is housing. I have constantly said that we need to talk about what is being built in Ireland and address the issue that we are building units that serve only one type of family. Allowing those with disabilities to live independently must be a core priority. I actually was delighted last month to attend an opening of the KCC housing project in Castlecomer with Minister Darragh O'Brien, which is a development in rural Kilkenny which has one-bedroom units. Now, it's an unusual occurrence in county towns, and it's a sign of how, you know, we need to build more diverse units for all of us, and I think that has to be in the housing programme for all. We need to build homes, particularly that are adapted to people with disabilities, whether it's a wet room, that's so important, and a bathroom downstairs. And I think long-term we will be saving the government by doing that, because these will have to be built anyway. I would also like to see more priority given to families on the housing list in local authorities with children living with disabilities and also with adults with disabilities. And I just again talk about Carlow. Carlow has a population of 56,932, and 14% of those are living with at least one disability. That's why I have been working with Carlow County Council to ensure that we provide more purpose-built housing for those with disability, and that we make the public aware of the disability grants available to them to remodel their existing homes. And I think that's huge information. You've got to get the information out there for people and families. And I think if we have more campaigns like that, I think people will learn from this. People with disability are more than twice as likely to report discrimination in relation to housing, and are over 1.6 times more likely to live in poor conditions. And these are important considerations when we look at, providing good homes. We need to look at this. Respite, look, it's another huge issue for me. Minister, and I've said this, and I know you're doing your best too. Look, this has to be positive today, because we have to make change. And another area, I had someone contact me recently. She said she was entitled to the free travel, and she said, well, it's great, but there's no public transport link around the County Carlow, Jennifer. There are public buses and trains to major cities, but nothing internal. We received the great news, and which we have, that Carlow is getting its own town bus service, so that's so important. But we do need to make sure that there is other transport there, because it's all about, but when you're in rural Ireland, you know yourself, you have to get a car to go everywhere. You have to get in your car, and you have to do that to get around the county and to get to your services. And I just think we need to look at that. The other issue, Ministers, is, and I'm just highlighting these because I know we're all going to work together on them, is medical cards. An absolute nightmare for me. And I just think people with disabilities, or people that need them, should automatically get them. And I would ask maybe that we set up a team or some sort of a committee so that we can address these issues. I was also contacted by a lady in Carlow. Now, this to me is a really sad case, where there was a horrific accident there about a year and a half ago, and her daughter was left paralysed from the chest down, so she's now in a wheelchair. And she said to me, when she goes to bring her daughter out for a walk, particularly around her housing estate, she said the fear she has of the daughter in the wheelchair actually going to fall out because of the footpaths. And I just think we cannot allow this anymore. We've got to make sure that wheelchair users, or people with maybe visually impaired or whatever, we need to make sure that our footpaths and our roads are safe for them, and that was the biggest concern for her. But the biggest thing that really annoyed me here now, and it's something that I'm really tormented over, and I've put the appeal in twice. The mother has applied for the carers for her twice and has been refused. And her daughter is a 24-hour job. She's a great mother, she's a beautiful daughter, and yet she has been refused carers. Minister, you couldn't make it up. Honestly, I'm going back at it again. I just can't believe it. And even just trying to get nursing and trying to sort out the issues. So we do need to get all these issues sorted, because it just means that the most vulnerable people in our society, we need to give them more support. We need to be there and try and be there more for them. And I would ask you that in this case, and Minister Abbott, I have gone to you about this, and I know you will come back to me, because I know you always do. I have to give you credit to where credit deserved. Another case that I'm working in at the moment is children with epilepsy, students sitting their leaving cert, who have seizures, cannot properly sit the exams, and are essentially excluded from the CAO. These seizures can be triggered by stress, tiredness and irregular eating patterns, all of which go, as we know, hand in hand with the leaving cert. Now, there was a mechanism for students who acquired COVID to resit their exam, but not for students with epilepsy. These are simple barriers, but as we have these policies in place, all we need to do is change them, and I would ask that we do change all these policies. Another issue I want to talk about is, and it's a big issue, is carers. I'm actually working with a case today where a chap has to come home from hospital, and we can't get a home care package in because we don't have enough carers. Now, I know that their funding is there and you're finding it hard to get staff, but my understanding is that recruitment process is beginning to bear fruit now, and I'm delighted with that. But the decision by the Department of Enterprise to exclude home carers from the critical skills exemption to the non-EEA employment permit system was not helpful, and it meant that we are struggling now to get these staff, so I would ask you about this. Look, I just feel I have so many things that I really need to highlight, because I know myself, I work with it every day, like all of us here, as TDs and senators do, and I know I work with Minister Roger O'Gorman and Minister Rabbitte on all the different things. But another issue that just has been kind of something that I've been working with a lot of people is we must discuss the personal assistance, individual choice about which aspect of social, economic and political life to participate is also this is something that has come up to me recently, and it's something I just feel we need to make sure that we give people that choice. And I see how important personal assistants are for disabled people, and I see how this has to be valued. And personal assistance services in Article 19 would ratify that the right of disabled people to live in the community have a right to access the services that would allow them. All I'm just saying is, look, again, it's just so important that we make sure that we do what we can to work with all the different disability services, because it's about communication, it's about everybody working together, because sometimes that doesn't happen, Minister. And I know since both of you have become ministers, you have worked extremely hard, and I want to thank you for that. But we do have a lot of more work to do. And I'll just, okay. Thank you very much, Cancun, and thank you, Minister.